my name is Ghinwa Hakim, and you are watching the Arabic Hour.
High-tech, I think it was amazing to see the possibilities for the doctors. And one of them told me that, in 5 years, there will be no doctor in Gaza who know how to do IV.
The October 23, 2015 seminar discussed the situation in Gaza, the effects on the mental health of citizens in Palestine, and how the Gaza Community Mental Health Program, GCMHP, works to aid the people of Gaza. The event was co-sponsored by the Palestine-Israel Task Team of the First Church in Cambridge Congregational, the Gaza Mental Health Foundation, Grassroots International, Jewish Voice for Peace, Boston. Guest speakers were Dr. Yasser Abu Jamal and Rand Goldstein. Dr. Yasser Abu Jamal is a psychiatrist by profession and became the head of the Gaza Community Mental Health Program in 2014. Dr. Jamal's interests include the child and adolescent psychiatry, neuropsychiatry, and advocacy through the Gaza Community Mental Health Program. Rand Goldstein is the former head of communication of the ICRC delegation to Israel and the occupied territories, and a former journalist. In addition to leading campaigns regarding human rights issues in Israel, he is the founder of an institute for Israeli-Palestinian conflict research called Akevot.
So my name is Nancy Murray. I am the co-founder of the Gaza Mental Health Foundation, which has been around since the year 2001, raising funds to support the work done by the Gaza Community Mental Health Program and now other organizations, women's organizations, especially in the Gaza Strip. And we are very, very pleased now to have with us the successor to someone many of you probably knew, Dr. Iyad El-Sarraj. I know many people in this room came to we did a memorial service after he passed away in a church just down the road. We are very happy to discover, thanks to Dr. Yasser Abu Jamal's trip, that the GCMHP is in incredibly good hands. And that's what you will be hearing about, their work today. And also Rand Goldstein, who is the executive director of Physicians for Human Rights Israel, will be talking about how they work as well in Gaza and with the GCMHP. So I would like to first of all thank Gay Harder, who is here, and the Palestine-Israel Task Force of the First Church in Cambridge Congregational for making this lovely little parlor available to us and for their support in all sorts of ways. The other co-sponsors of today's, besides the Gaza Mental Health Foundation, the other co-sponsors are Grassroots International and Jewish Voice for Peace, Boston. So thanks to all our co-sponsors. And now, before we get started with our two speakers, I want to introduce Donna Baranski Walker, who is the executive director of the organization that brought the speakers to the United States. It's called Rebuilding Alliance. It's done quite amazing work getting materials not only into Gaza but into the West Bank. And she's going to say a few words about their program, and then she will introduce our speaker.
I'm delighted to have this opportunity to introduce our speakers. Rebuilding Alliance brought forward this speaking tour because we knew that everybody had to hear these important voices. I can tell you a little bit about Rebuilding Alliance. So first, I'll tell you a little bit about something we're working on next. We just were able to get a container of backpacks and school supplies into Gaza. It arrived about a week ago. And the next container of backpacks and school supplies, it's sort of a philosophy of how do you open a blockade? Well, let's start with something tangible. We'd like it to include these lights. They're called Lucci lights. Why lights? The power is only available 6 hours a day, and it's sort of random hours. So if you really wanted children to do their homework with those school supplies and the books, children's books we're sending, then you'd need light. And so having this solar light, an expandable solar light, but it requires all of us to help, actually. Not only on we'll be raising funds and whatnot, but I would ask your help to call your members of Congress. All of our shipments are pre-approved, so we go through an approval process, and it was because of my member of Congress, Anna Eshoo, and our senators that asked for help when the shipment of just the backpacks was delayed. And it worked, and they got in. So with this one, when we go through customs, we're going to pre-approve it before we even send the container. I'll have those forms ready. Probably I should have them ready by Thursday when our team is presenting in Congress. And if you can do two things, one is ask your members of Congress to attend the briefing on Thursday, Cannon House Office Building, room 129, 1:30 in the afternoon. They should attend on your behalf. And then you can ask them if they will help also with these lights, getting solar lights into Gaza for the children. It's just an easy ask. We'll give you other possible ways to help, but this one is kind of nice. Rebuilding Alliance has been around since 2003. We formed to be able to rebuild war-torn communities and work to make them safe, really bring the world together to make them safe. And so we've been helping rebuild Palestinian homes and schools, playgrounds, we just put in a birthing center in Area C funded by Rotary clubs. So exciting to make that happen. Takes a while sometimes, but it's good to see a lot of groups coming together. Making it safe means being able to advocate. We found that our members of Congress will engage. Usually they would engage secretly and privately, but they'll make a call on your behalf to the Israeli embassy, and they'll also call the State Department to keep a village standing, to protect a school from bombing. They'll actually take some initiative. And one thing that really surprises us is that lately they're being more public about it. So if you saw Senator Feinstein's tweets about keeping the village of Susia standing, that was our delegation last month. We brought the children from the village to the senator's office, and we did a briefing in Congress with the children and their parents from Susia, from Al-Her also, another village under demolition orders. And it was great to see this very public response. It is keeping Susia standing. When we did our briefings, visiting Congress in June, anticipating what would be coming, that kind of helped get everyone ready. And when the army told the villagers they would be demolished after Ramadan, the State Department sent our Consul General to Susia. They publicly held a briefing about it. Anna Eshoo and 10 Congress people signed a letter to the State Department, and then Dianne Feinstein sent a public letter to Prime Minister Netanyahu. It's not enough, of course, but it's a start, and something that we seem, like one forgets that Congress can actually be pushed to represent us on this issue. And it's always helpful if we can get voices of calm and reason to prevail. And I would contend that if we don't do it, the other side does it all the more. So, it's important to get our words out and to give them opportunities to learn from people who are there. Rebuilding Alliance often puts peacemakers from Gaza, from Israel, Palestine, all on the telephone with constituents and congressional staff. And that's been a very effective program. That was what we've been doing for years now, almost when we don't know what else to do, it's what we would turn to. So in the bombings in the summer in Gaza, we did that. We're the group that rebuilt a home for the family Rachel Corrie stood to protect. And Rachel Corrie's parents, Cindy and Craig Corrie, were founding board members of Rebuilding Alliance. So that family, and everyone knows who Rachel Corrie is in this audience. Okay. That family, we turned to them to call during the bombing, and Khalid Nasrallah, a social worker at one of the UNRWA shelter schools, he explained that people had nothing to live for. And he also explained that he had 2,300 people in his school and the plumbing had given up. It just stopped. He said, the smell is atrocious. And he asked our help to deliver hygiene kits, which we did with the Rachel Coy Foundation. We did it on credit from the stores in Gaza and did it for his school, all the families, and all the schools in Rafah, then all the schools in Jabalia and Han Yunis. So it was really surprising and good to see, all right, something, we can do something. And that would continue to clothing and then the backpack kits for now. We're a building company though, so we're part of the shelter cluster at the UN, and we look forward to doing building projects. That we will move you toward advocacy on that very important issue about dual use items that include cement and steel, all the things you need to build houses that really needs to be addressed. I chose to bring it was really important to bring forward these voices to you. And I wanted to explain how I came to know Dr. Yasser Abu Jamal. I called, Gaza Community Mental Health Program had been Rebuilding Alliance's sponsor in Gaza for our building work and anything we were doing there. And then I heard the news, and the news was the hardest news I could imagine, that 28 members of the executive director's family were killed in one bombing. And so I called in condolence to the people I know there, and I said, I just need to bring this forward, and they said, talk to him. You need to talk to him and bring them onto this program, this format of conference calling, and I didn't know what I could possibly say, but they said he needs to talk, and you need to listen and make this happen. And so Dr. Yasser Abu Jamal gave me words that I would never have found otherwise. And I knew that I had to bring him here. You had to hear from him too. It would take this year and a half, in part because you're very busy. So it was a good thing to make it happen. And Ren Goldstein from Physicians for Human Rights, it's no accident that we include Physicians for Human Rights Israel in this speaking tour. They were both formed, the two organizations, at about the same time. The founders were very close friends. Ruhama Marton, a doctor at Physicians for Human Rights Israel, and Dr. Ayad al-Siraj. So it is important to continue that relationship and have you hear from both groups. So let me introduce Dr. Yasser Abu Jamal first. I wanted to say that he did his training in Lithuania, so he's well familiar with Boston winters. Gaza Community Mental Health has a very strong goal of training new psychiatrists, psychologists, the teams that would help. And so he too is a product of some of that training. So what Dr. Ayad al-Siraj put in place then is realized through Dr. Yasser. I think with that, I'll let you speak. Come join us.
Good afternoon, ladies and gentlemen. Another warm welcoming and another great day and another neighborhood, another church, another meeting, another group of lovely people who come to attend and hear the stories that come from Gaza Community Mental Health Program. And I am really honored to be here today with you. I am honored to see people from grassroots organization, from Rebuilding Alliance, from the Gaza Community Mental Health Program. It's the same actually, from the Gaza Mental Health Foundation. We have Maya and Tony, our colleagues and friends from Harvard, and many of you who are actually here whom, we had the chance. Nitin, how are you, Nitin? It's good to see you one more time. I saw Nitin a few years ago back in Gaza. So this is something that some people think about Gaza when it comes to their mind, And what I am coming here for is to say that, this is part of the scene, but there is another part of the story, which is how people are doing trying to go on with their lives, and how the organization I work for tries its best, with the group of people who are working there to improve the conditions. And that's what I'm going to speak about in the next 10, 12 minutes because I wasted some time on things. But anyway, so this is the Gaza Strip. It's a very small geographical area on that side of the historical Palestine, and it has some interesting facts about it, like how many people live in there. We have more than 1.76 million people, and this is the least figure that we found. We do not want to say 2 million, so it's 1.76, including 70% of them are refugees. This area is occupied since 1967. Almost how many years? Almost 50 years. 48 years, and it's under the siege since the year 2007. Now, when we come to speak about the siege, this is very interesting thing. It's more like an open air prison, if we can just say about it. When the siege started, there was a list of almost 17 items that used to be allowed to get into Gaza, and one of the remarkable breakthroughs that one of the international diplomats was managing to do is to add pasta to this group of items that is allowed to get into Gaza. And no one please ask me why pasta was not allowed to get into Gaza. I have no idea. I think pasta is made of anyway. So nevertheless, Ran was making a joke about it, if I could use it. He said the only problem about pasta is if you don't know how to cook it and then you eat it, then you are like having problems. Anyway, with the siege going now for 8 years, many other problems appeared of that, because there is an international report that came to the light in the last couple of months, says that Gaza is not going to be inhabitable by the year 2020, because already at the moment, not even there, already at the moment more than 90% of the people do not have access to safe water. Good drinking water that when you drink it, you are not afraid of diseases. More than 70% of the people are relying on food aid. These figures are alarming. More than 45% of the people are unemployed, and when it comes to the age 25, 35, these are the most unemployed people, with something like even up to 65%. And on top of all of that, you got 3 different large-scale attacks, offensives, war, name it what you can. One was 6 years ago, one was 3 years ago, and the other one was 1 year ago. So my son, who is 11 years old, he was in 2008 he was 5 years old, and in 2014 he was 10 years old. So more or less he witnessed the 3 wars, but he saw them in different ways. One as a child who doesn't understand what happens around him, and last time he was like a child who was really feeling what's happening around him. So the question is, what did that mean? I mean, what was that about? And it's very important to keep in mind the continuous shelling and bombardment. Some of the international, and I keep saying international reports because these are things that you will find on internationally acknowledged websites like OCHA, like UNRWA, like UNICEF, and they said that during those 51 days more than 50,000 shells were falling on Gaza Strip. Some of them are like artillery, some of them airstrikes, some of them are naval, some of them are tank shells. And let's imagine that in that small geographical area, 1.76 million people live. Among them, 52% are children. So we're speaking about how many children? 900,000 children. And they are all day and night hearing the loud explosions and bombardment. How would that feel? Of course, when the land operations started, more than 500,000 people were displaced from their homes. 500,000 people, among them at least 250,000 children, who were displaced not to a safe place, but who are displaced towards the west of Gaza Strip, sitting not in shelters but at UNRWA schools, who started to become or to be named as shelters. So that's why for 51 days many people, almost everyone, continued to lack sense of security and safety, in terms of terrifying, that anyone could die at any moment. You don't know whether you are going to die today or not today, or whether you are going to stay until tomorrow or not until tomorrow, because out of the 2,000 people who got killed, 70% of them were just civilians. They were just like that, including 500 children. More than 11,000 people got wounded, including 3,300 children. 18,000 houses were fully destroyed, leaving more than 100,000 people homeless. These are just simple statistics, but what we care about is how did that affected the people. Yesterday I was talking to some people and they said, what's the news story on the news? Do you know what's the news story in the news? I don't know how it went, by the way. I haven't had the chance. More than that. In the international CNN, when you go to the story yesterday, it was the hurricane in Mexico. That was the big story. Just let's think what's the media takes the attention, or takes people attention to the hot areas, to the hot big stories, disasters, whether it's a war, human-made, natural-made, or whatever. And when that story ends, they go to another one. Yeah? But the problem is that who is going to talk about what that story leaves behind? Okay, the disaster stopped, but it affected not only the houses, not only the property, not only the buildings, but also it affected the people. Those 3,000 children who got disabled, who is looking after them, who were wounded? Those 2,000 families that lost some of their beloved members, is there anyone who's working with them? Can someone walk them through the trauma, open to them a window to the future, that this is not going to happen again and again and again, although it happened 3 times. And that's part of what we try to do. And then someone would say, okay, what would be the mental health conditions of people in Gaza Strip following these events? And we look at very simple 3 realities or figures. UNICEF estimated that 370,000 children are in need for direct help, psychosocial support, specialized psychosocial support. And that was in August, immediately after the war. They thought that at least 370,000 children are in need for that type of help. WHO, generally speaking, they say that in areas of, emergency, those people who are living there, affected inhabitants, about 20% of them will be in need for care. Why? Because they might develop mental disorders. So if we speak about 1.8 million, how many of those will be in need for it? 400,000. Wow, this is too much. We tried to investigate 1 year after the 2012 attack, how is the conditions of the children in Gaza Strip? And we found that 30% of the children who were affected by high level of bombardment and exposure, they were still having problems or suffering from symptoms of PTSD and some accompanying disorders like emotional and neurotic disorders. So these are big figures, and the question is, who is helping those people? These figures are challenging any health ministry or any health institutions in any place in the world. And then the question is, who is helping those people? Well, let's see at what we have in Gaza. And usually they have this pyramid. You say in emergencies, let's try to make sure that all levels are, addressed. So at the very basic level, we speak about social considerations, Make sure that people talk to each other, make sure that they live in a safe place, make sure that they have all what they need available. At a more specific level, strengthen the community and family support. Make sure that families, that each one has a family that, holds him, that there is a strong community support. Well, you get to more specialized a little bit, and then you speak about focused support. Like if you do some counseling in the schools, in primary health care, if you do some more education, specifically addressing some issues. And then on the tip of the pyramid, it comes to the specialized services. Specialized services, it means treating, intervening at the level of people who are in need for specialized care. When it comes to specialized care, then we speak about mental health disorders. And among the most ones that we find in adults, it's depression and then trauma-related problems. So depression is the first one. Now, since the ceasefire until today, more than 35% of adults have depression who visit us. I'm not speaking about the community. 35% of the patients who visit us, they have depression. 25% have post-traumatic stress disorder. When it comes to children, unfortunately, we have higher level of PTSD, post-traumatic stress disorder, but it's expressed in another way. What does that mean? You know, children are not grown enough at some early life stages of their life to be able to express themselves. You know, we can say, I'm unhappy, I'm disappointed, I am not satisfied, I am frustrated, I do not see any, I am pessimistic, optimistic. But children, they are not, you know, quite, you know, 4, 5, 6, 7 years, you know, they cannot say these things. They are not yet, you know, grown enough to speak about their feelings in that way. But they do different things that we don't like. We as adults don't like children who start to misbehave. Yeah? We don't like that at all, you know. And so change in behavior is very common. Another way of showing things, night horrors, you know. If you see a bad dream, you wake up in the morning, you know, and you start telling your wife or husband about it, you know. Look what I dreamed of. And she will offer you some kind of care, or you will offer her, depends upon how close you are, you know. But in children, it's not nightmares, it's more like night horrors, which means the child is screaming in the middle of the night, and you are trying to awake him or wake her up, and they are not awakened, you know, they are just screaming. So after some few minutes of awaking him, he is awake, and you ask him, what's wrong? I don't know. What were you seeing? I don't know. How could I help? I don't know. So you just give him a cup of water and then you just let him go back to sleep. Another way of showing the problem is bedwetting. Children will just go into sleep and they wouldn't know what happens around. And, you know, and we have very clear connection between bedwetting and trauma, you know. And we say that you cannot heal bedwetting unless you deal with the traumatic event. So, and the fourth one, which is also very important, is the low school achievement. Children start to, you know, get lower marks in the school. And that's also alerting for the parents, because we have only one hope when we live in Gaza, which is to invest in the children, you know. Maybe our life is difficult, but we hope that their lives are going to be much easier. So to keep giving them a chance, you need just to continue the education. So who is going to deal with these things and intervene at this tip of the pyramid level? And then we go and see how many people work in there. So at these levels, the very basic ones, you find many international and local non-governmental organizations who really do a lot of work at these levels, you know. Family support, networking, doing some education, psychoeducation, talking to people. But when it comes to the tip of the pyramid and a little bit of the non-specialized support, the focus support, there are only two places, which is the Gaza Mental Health, Gaza Community Mental Health Program. I was going to say Gaza Mental Health Foundation. And the other one is the Ministry of Health. What makes a difference is that we are more equipped, more capable of providing care to children. 50% of our patients are children, another 50% of them are clients. And we have the capacity, we have the training, we have the skills, we have the play therapy rooms, we have the needed resources in order to make this service available to help the children. And the question is, how do you do that? How do you change a child who does not know how to express himself and you approach him? How to do that? Well, we can show you a few examples of how we do that. You know, a child will come, he is not, you know, doesn't know what to talk, and he will enter a room full of toys. And the question is, you go and pick whatever toys you would like to play with. Go and pick one, or pick two, or pick three, or pick whatever. Some children will pick a family structure. and will start to speak about the problems between his father and mother. It might happen. Other children will bring like siblings and will start talking about how his brother is beating him. A third one will pick some other things. He could pick an ambulance, soldiers, other helicopter, Apache, even other things, And then the child, children when they play, they speak, They do not talk to you. They just speak about what they feel, what they say. They tell the story. They start to narrate things in the way they saw it happen or heard it happen. And then you start to think how to involve their parents, change that story. How? Because this means that the child is feeling unsafe. How to make him feel safe? He is not sleeping well because when he does go to sleep, he doesn't know if he is going to be able to sleep until tomorrow or not, or if he is going to hear a missile falling or not. You need to tell the parents to intervene. When you sit with a child for 1 hour or 2 hours a week, you are not going to change much, but the change is going to come through his parents. So we work with children and we work with their parents. It's very important to involve them. And sometimes, when time passes, then there are more means of encouraging the child. Just tell the story, through puppets. Yeah? And you see, he is just smiling there, This is not his first day at therapy. Smiling, getting involved and simply talking to the therapist. Another way, sometimes children do not even speak that much. So I tell him, would you please pick a paper and draw if you do not want to speak? They sometimes do that. And they draw, you give them some time, you sit with them, you watch them drawing, and then you ask them, could you please tell us, what's there in the drawing? And then they will start speaking about their fears, about their experiences. And we go with it the same way. You involve the parents. You teach them that if a child is disobedient because he is not happy with his life and he is rejecting his whole life, he is rejecting the conditions he is living in. And his way of rejecting that is to be disobedient. Yeah? If a child is wetting his bed, maybe this is the only way that in the morning he will receive a very special attention. Especially that in Gaza you have the average 5 children per family. And mothers wake up at 6 o'clock morning. They provide clothing for their children. They make breakfast for their children. And then they go to school. And before they go back, she starts preparing her other children because we have schools that are operating in 2 shifts. So the other gang, they pick their luggage, everything, and they go to the school. And then the first one have already returned, So she spends half of the day between preparing her children to go to the school and then come back from the school. And then His Excellency, the husband, also he needs lunch, he needs, food, and he is like, the most demanding person in that club, and she has to deal with all of that. And sometimes one of the children is, not feeling that any attention is given to him. And let's not forget that electricity is on like for 8 hours a day, sometimes 12, sometimes 6. So she has to do some washing, she has to do some ironing, And that all happens when the light is back, when the electricity is back. And maybe the only chance for that 7-year or 8-year-old child to receive that care is when he is awakened in the morning with his bed wet. So then he gets some attention. Unfortunately, sometimes he gets the bad part of it, like being shouted at, being blamed for not being clean, you should grow up, and all of these things. So very important part of the intervention is talking to people and not to forget to open new hope for the children. How to do it? You are Gaza Community Mental Health Program. You treat people. Yes, we try to treat them, but also we try to work at another level, which is those are children. They bring up memories, they build up their cognition. So you need to identify spots, and add some light to their minds, So how you do it? In many ways. You engage them in what? In dancing, in singing, in playing, or simply you invite one from outside. You invite Mickey Mouse. Yeah? He is in Gaza. Doing what? Playing with the Palestinian children. What is their reaction? They are happy. They are doing the activity. They are really engaged. That person is not Mickey Mouse. He's not related to him. He is just one of our staff, you know. And this is something that, despite the fact that we are a specialized mental health service provider, but we keep in mind that these activities also are very important, because you add colors to the people's minds, you know. You try to find hope. You seed hope if it's not there. And then you just, you know, irrigate it. It's something like you try to do it your best. Sometimes people do not understand how difficult it is for their children, you know. And I don't want to tell hard stories, you know, but one of the stories is that we had an 11-year-old girl, you know, who was brought to our attention only in January, 5 months after the attack stopped. And she came because the school counselor told her, you should go and get special treatment from GCMHP. Because we work with schools, we work with CBOs, community-based organizations. We work with many people. And he referred her because of her misbehavior. She was like having many quarrels with her classmates. And when the parents brought her, there was a big story behind it, you know. She started to have earlier, she was loneliness, she was feeling alone, she was having some nightmares, you know, and she was like, you know, getting more and more isolated. And when we asked the parents what happened, you know, is there anything that is unusual happened, especially during the wartime, and they said, well, her sister got killed. What? Yeah, in front of her eyes. They were playing together and suddenly a sharpnel. It was nothing major, you know, explosive, not very close, but a sharpnel just killed her sister. And imagine, for months, the mother didn't talk about it, the father didn't talk about it, the brothers and sisters didn't talk about it. Like, you know, they just tried to go on with their life. They avoided talking about these things. And we ended up treating the whole family, not only the 11-year-old child. And usually when people bring their children, they bring their stories. So when you involve the parents in healing their children, you are also healing the parents. And that's why we all the time try to spread the news that if a child is misbehaving, think about other possibilities. Do not wait until things get worse. So if they are not coming to you, you go and speak to them in their communities. Sometimes you go and speak on the TV or on the radio. You just need to involve more people, to speak to more people. And then you end up with having this. Yeah. Making children back, smiling, alive, happy, thinking positively about the future, and saying to people in the United States, have a very nice day. Thank you very much. I'll introduce Ran, and then I'll let the video start, and then he could go on. You know, when we were established in 1990, at the same time, you know, Iyad al-Sarraj, the great man, the inspiring man who was working in a psychiatric hospital, he thought that a psychiatric hospital is not the right place to treat people who are victims of human rights violations. You know, you cannot hospitalize someone because the child is wetting his bed. This is not right, you know. So you need to talk to them in the community. So he left the psychiatric hospital and he established the Gaza Community Mental Health Program, which grew over the years to become 3 community mental health centers. We have a large different training programs that involve the community, community-based organizations, and almost increase awareness in the whole areas regarding mental health. We have a short video about that I would like to show you. And that time, on the Israeli side, there was also some great people who were like thinking how to help people in Gaza. And Ruhama Martun, who was also a psychiatrist, started or visited Gaza with a group of 6-7 physicians thinking how to help. And then the idea of establishing Physicians for Human Rights Israel started. So they started that organization, and she's still there. Our Iyad Sarraj just left us and passed away like almost 2 years ago, but left that spirit among the people who work for GCMHP. Ran is the current Executive Director of Physicians for Human Rights, but before giving him the floor, I would like to show you just a very short and fast video about the Gaza Community Mental Health Program.
So thank you very much for hosting us. It's really nice and warm here. So as Yasser introduced me, and Donna, I am Ran Goldstein. I'm the quite newly Executive Director of Physicians for Human Rights, but I know the organization for many, many years. And how many of you are aware of our organization? It's for Physicians for Human Rights Israel. Okay, there is also Physicians for Human Rights United States. We have work contacts with them, but we're not the same organization. We're not under the same umbrella even. Okay, so just to know the difference between the organization, it's important for them that I will say always that we are Physicians for Human Rights Israel. So in case you want to donate us and not them, just make this now. They are very good and important, and they are doing a remarkable job nowadays in Syria. So we were established actually the same time as the Gaza Mental Health Community Center by sending doctors. The leading was Ruchama Marton, the establisher and the founder of the organization, doctors into Gaza. And it was very humanitarian act, very simple to see what's going on, and the decision that doctors should be also activists. Doctor could not stay only in the sense of, okay, we see people, patients, and we treat. We have also other obligation, other things that we should do in the society, and it is also change the reality. So in Physicians for Human Rights, the way we work, yeah. So what do? We do actually three things. We do very basic work of physicians. So I'm not a physician. My staff are not physicians. They're all activists. And one day, if you want to try and have management skills, try to manage 30 activists. But our volunteers are mostly medical staff, meaning nurses, doctors, pharmacists, and we do really, in a second I will show you, individual help. This individual help includes other things, not only giving medicines, but it also gives people help in permits. If someone in Gaza and need to go out from Gaza to medical treatment in the West Bank, for example, he cannot just, call to a doctor in the West Bank, okay, I will see you when there is a next appointment, I will come in 2 weeks. No, it doesn't work like that. He needs first to get the permit from the Palestinian authorities that will cover this treatment. Second, he needs to get the permit from the Israeli authorities. And many times it doesn't work. It doesn't even matter if you are, it is matter if you are a child or a grown-up person, but if you are a man, 20 years old, the chances that you will get this permit are very low. So many times when they security prevented, they approach us in Physicians for Human Rights, and we approach with also our doctors who going over the files of the patients from Gaza with a second opinion. Also, we write why it's so important he will go out, because if somebody, for example, on a wheelchair and has the ability to have a surgery in West Bank or Israel, that he will walk again. So it's quite important, I think. And it's not obvious to give this kind of person a permit. If someone is blind, for example, or is becoming blind, and a very simple surgery can help him to see again, this is something that it's not very obvious to the Israelis to give a permit. We should fight for those people, and they are security prevented. That's why they cannot go out. But security prevention is something very, very wide, not very clear what it is. You can be someone that a family member, someone from your family was killed by Israel, and then you are security prevented because you have now motivation for revenge. Okay, so this kind of logic way of thinking put many people without medical treatment in the end. I'm not talking about the situation in Gaza and the medical health. We'll go there, and the medical situation or the health system in Gaza. I will go to that in a second. So this is humanitarian work. We also work on policy change. So human rights organization, not only as giving services, we also work about advocacy. We go to parliament member, we go speak with the IDF, we appeal to court, we go speak with diplomats. We try to change everything which regarding health and human rights, but in very broad sense. So also you will see our names against house demolitions, of course. You will see our names about any big human rights violation that we are fight against. You will see our name there, because we're not only talking about health in very in very small sense. It will be also a very wide perspective of human rights. Education, training, and medical ethics. This is something that also we're dealing with. So for us, the next generation of doctors or medical staff in Israel should also come with a sense of human rights. Don't know if you will go, I'll get to that in a minute. So I talked about mobile clinic. Mobile clinic is something that we are running for 27 years, 28 actually, years, every Saturday in the West Bank. Today we've been in Akraba village, which is south to Nablus, if someone knows. We have doctors who go to the field, Jewish and Arab doctors, Israeli citizens, who goes and treat hundreds of people. Today they saw more than 300 people. In a year they see more than 18,000 people in those. Every Saturday there is a clinic. And it's not, I admit, it's not important in the sense that we can, solve the problems of the people. But many of those people don't see on a regular basis a doctor. Many of the people don't have money to buy medications. This is something that very important that we bring with us. Many of those people don't even know that what they have a very simple solution. Or sometimes they don't even know that only change on behavior or prevention steps they can take can prevent the problems. But the mobile clinic not only goes to the West Bank, it goes to Gaza as well. And we have Israeli Palestinian doctors who are allowed to go to Gaza. So every 5-6 weeks we enter Gaza with doctors who perform surgeries in hospitals, who do training for doctors, because for many years doctors could not really leave Gaza for trainings. Sometimes they do, but it's not something that regularly goes. And those doctors also can give us the real picture or the real situation of what's going on in hospitals in Gaza. And the picture is very sad. There is very poor situation of medication supply, very poor situation of equipment. The hospitals need to run generators every 12 hours because the power is running only 12 hours a day. And generators in hospitals should be only for emergency. But this is the daily life in Gaza. And I told you about trainings. So the week before I arrived here, and it's already a week I'm here, yeah? Yeah, time's flying, huh? And I'm joining as well. So a week before I came, we succeeded to organize a training for 11 doctors from Gaza for the first time after a few years for 3 days in hospital in Israel. It's in Sheba Hospital Center, simulation center, very high-tech, I think it was amazing to see the possibilities for the doctors. And one of them told me that, in 5 years there will be no doctor in Gaza who know how to do IV. Because doctors, infusion, how do you say, infusion? Infusion. Because in Gaza, every doctor who could leave already escaped. Everyone who had the possibility to find better life did it. So also the level of doctors and the training they got is very poor. So we're talking about a system that will not be able to cope with another war. We talk about a system that already in the last war didn't have the ability to give treatment to so many wounded. We know that wounded in the last war, people seriously wounded, where they put them with dead bodies because nobody had paid attention that they're seriously wounded and not people who were killed. We know that during the war, people with chronic problem, people heart attack, diabetes, everything that society have, every normal society has, it happens in Gaza. But during the war, hospitals didn't have the ability to treat those people. So we don't see any possibility that another war, how Gaza will cope with another war. And unfortunately, it seems that this is the only solution that the politicians so far suggest to both people. We don't see any other solution at least from my government, which is the Israeli government. I don't see any other solution with Gaza. We see only security solution, and another security solution. They talk only about how we protect ourselves with security measures, how we will attack Gaza, but nobody talk about bringing peace. So mobile clinic, we have also, just to give you the framework of the work of Association for Human Rights, so it's not only regarding occupied territories and Palestinians, we also work with refugees and asylum seekers in Israel, and everyone actually who doesn't have national health insurance in Israel. So we have an open clinic in Jaffa that also run by volunteers. I said something about education, so we want our doctors to be activists. So this is an example of doctors who are refusing to obey the force feeding bill. Force feeding bill is something that lately the Israeli government in aim to deal with the hunger strike of Palestinians. You know that Palestinians quite often in the last 3-4 years went on hunger strike protesting the administrative detention in Israeli prison. So Israel decided to pass a law which will allow doctors to force feed Palestinians who went on hunger strike. So, and I admit that I was a bit surprised for the very strong voice of the medical community against this bill, because it's not very usual. It's not very usual that you have a group of it is a guild. Like Israeli lawyers, we never heard their guild saying something against the occupation. architect. They built the wall, which is, one of the most ugly things in the world. And no architect, except of there is a human rights organization of architects, yes. But except of them, we didn't hear the union of the architects saying something against this wall. And we were very happy that the union of the Israeli Medical Association, the union of the doctors, was very vocal against the force-feeding law. Okay, this is a campaign that we ran, Physicians for Human Rights ran, with people who are members in our organization, who are doctors in hospitals, who said, we're refusing to cooperate with this bill, with this law. But we want doctors also to not to accept that. We don't want doctors who are in hospital to accept the fact that 17 years old, never mind what he did, he need to lie in hospital shackled to the bed. We want them also, the Israeli Medical Association, to go and be vocal about that. Because this is a patient. The doctors should see Palestinian, Israelis, whoever, whatever he did, and we don't ask them what they did, as patients. And it's not the situation. It's not the situation because in Israel, everything, integrated between politics, security, and it's very difficult to stay, to really keep your own medical ethics. I wanted to leave much more room for questions, but I wanted to give you another example of what we do. We have also, I talked about people who are non-residents of Israel, we have no national insurance. I talked about Palestinians, but we also work with the rights to health of Israelis. So what we see here, for example, donation to hospitals a year. So we see to the south, the hospitals in Israel, to the south, 10 million a year. In the center of Israel, 77 million a year. So we also try to do advocacy regarding that issue. And another thing, so this is an example for a story which also combined the permit issue and the policy change. Small happy family. The only problem is the wife, she is an Israeli, and the husband is a Palestinian from Gaza. Yeah. And when she was about to give birth to deliver with her little boy, so the father wanted to go out from Gaza to be in the birth of his son. Quite reasonable. So he applied to the Israeli authorities. He was rejected. We don't know the reason. He approached us. We applied on his name. It took time. We didn't get a response. We went to court. In the court, suddenly he became someone that can be green-lighted from preventive security threat to Israel. Suddenly, after we applied, he's no longer a security threat. Israel allowed him to go and participate in the birth. The only problem was that it took 5 months. So this is the photo when they met first, and the baby, happily healthy, was already born. The thing we succeed to change was that from now on, Palestinian people who has an Israeli partner will be allowed to participate in the birth. Okay, so there is now another line in the long preventions, the long orders of Israel regarding what people from Gaza and the West Bank should or should not do. So there is a line now saying that if it's a birth, so the partner will allow to join and participate, which is a big success. It's a big success in this very depressing reality of the occupation.
That's all the time we have today. Thank you so much for joining us. On behalf of all of the volunteers here at the Arabic Hour, this is Ghanwa Hakim, wishing you a pleasant week.